Hello and welcome. My name is Sarah Barney, and I'm honored to present my scholarly project as part of the requirements for my Doctor of Nursing Practice degree at Maryville University. The title of my project is The Effect of Nurse Forecasting and Outreach on Adult Immunization Rates. I would like to extend my heartfelt thanks and gratitude to the individuals who have consistently supported this scholarly project. I am especially grateful to my chair, Dr. Aislinn Moyer, my second reader, Dr. Maria Snell, and my committee member, Amy Watkins, the nurse manager at the clinical site. I acknowledge that many other faculty members have also contributed to this project over the last several months. I would like to begin by discussing the background and setting for this scholarly quality improvement project. As a nurse practitioner working for an employer-sponsored health plan in the Western United States, my responsibilities include administering the plan benefits and providing care to participants. I serve as a bridge for plan participants who often face delays in accessing healthcare providers in the local community. Many of these participants come from various regions around the world and encounter typical challenges when trying to establish care with new providers in our area. I am also the medical director of a corporate employee travel and immunization clinic that serves the same patient population. In the course of my work, I observe that while these employees have access to the clinic, medical benefits that cover routine and travel immunizations, and primary care services, many were still missing recommended adult vaccines. Vaccines play a vital role in safeguarding individuals of all ages from severe illnesses, and they extend their lifespans. By stimulating the immune system, vaccines prepare the body to fight off infections, and they reduce the incidence of disease that could lead to serious health complications or even death. Vaccines are a fundamental aspect of healthcare. They contribute significantly to public health measures that improve well-being and quality of life. The World Health Organization emphasizes that vaccination is an essential component of global health security, and they aid in controlling the spread of infectious diseases. They protect vulnerable populations. Immunization programs produce benefits that outweigh their costs many times over, returning up to 19 times their initial investment. Moreover, widespread vaccination can lead to herd immunity, where a significant portion of a community becomes immune, thereby providing indirect protection to those who cannot be vaccinated, such as infants, the elderly, or individuals with specific health conditions. This not only helps to prevent outbreaks, but it also contributes to the overall stability of healthcare systems. In light of these benefits, promoting vaccination remains a key public health strategy to ensure that individuals and communities can thrive. Despite their impressive benefits, adult vaccination rates in the United States still fall below the recommended targets. The population targeted in this quality improvement project also had lower vaccination rates than desired. The project specifically focused on 3 adult vaccines that aid in the primary prevention of the diseases of pertussis, herpes zoster, and pneumococcus. Those vaccines are Tdap, Shingrix, and Prevnar 20. The proposed solution to address the issue of low adult vaccination rates focused on implementing nurse forecasting and outreach programs. This approach aimed to leverage the expertise of nursing professionals to predict vaccination needs and actively engage with patients. The central question guiding this initiative was, can nurse forecasting and patient outreach improve immunization rates for Tdap, Shingrix, and Prevnar 20? By utilizing data-driven forecasting, nurses identified individuals who were due or overdue for vaccination. This proactive strategy was designed to enhance communication and outreach efforts encouraging more adults to receive their vaccinations. The search for relevant literature was conducted in 2 phases. In the first phase, Ovid synthesis was used to identify literature related to adult immunization and efforts to improve vaccination rates. Ovid synthesis captures primary literature from the Medline and Ovid databases. After reviewing the titles and abstracts, this initial search yielded 50 publications, of which 6 were deemed relevant to the Quality Improvement Project. In the second phase, the Advanced Discovery feature of the Maryville University Library was utilized to search various health professions databases, including Medline, PubMed, and the Cumulative Index to Nursing and Allied Health Literature, CINAHL. This refined search resulted in 132 publications, which were further narrowed down based on their relevance to the Quality Improvement Project. Ultimately, the Maryville Library Discovery Search produced 8 relevant publications. Combining these findings with those from the Ovid search, the comprehensive literature review synthesized a total of 14 primary research publications. The analysis of 14 publications identified 3 interrelated themes regarding patient outreach strategies to improve immunization delivery. 1, the vaccines targeted for outreach. 2, the effectiveness of various outreach methods. And 3, the pathways to enhance vaccine delivery. Most of the reviewed studies primarily focused on the messaging interventions designed to improve the delivery of the influenza vaccine. Other vaccines, including those for human papillomavirus, pertussis, herpes zoster, and pneumococcal disease, were also examined for the effectiveness of their outreach effort, yielding varying levels of success. In some cases, barriers such as cost and access impeded progress, while in others, apathy or messaging fatigue may have contributed to a less than satisfactory result. The studies employed a range of outreach methods, including text messages, emails, postcards, and automated phone call reminders. Patient reminders appeared to have been most effective among older adults and individuals with existing medical conditions. However, the specific method of reminder did not significantly influence the outcome. In addition, using reminders alone was insufficient to address other barriers like cost and access. The diversity of the patient populations and geographical locations further complicated the ability to draw firm conclusions about the most effective outreach method. Despite these challenges, the literature review suggested that patient outreach can be a vital component of successful vaccine delivery, especially when combined with other approaches. These additional strategies may include implementing standing orders, appointing a designated vaccine champion, and ensuring the recommended vaccines are readily available on site. The clinical site for this quality improvement project employed all of those methods. The only missing element was nursing outreach to raise awareness of participants' vaccine needs. The theoretical framework for this project was introduced to me by my leader in the health plan, who has a background in economics. One of the key concepts we explored together is nudge theory, which has been extensively discussed by Richard Thaler and Cass Sunstein. This theory suggests that subtle interventions, or nudges, can significantly influence people's behaviors and decisions without restricting their freedom of choice. In our numerous discussions, we explored the potential applications of nudge theory beyond its traditional domain of economics. We examined how these principles could be effectively utilized to encourage healthier behaviors among patients and to improve overall health outcomes. For instance, strategies such as simplifying the process of scheduling medical appointments or providing personalized reminder for medication delivery could serve as effective nudges. The foundational concept of nudge theory revolves around the idea of removing obstacles to make it easier for individuals to make choices in their best interest. Choices typically fall into two categories: complex choices, which are reflective decisions requiring significant study and effort, and automatic choices, which are nearly effortless. When major barriers exist, individuals may avoid making a decision altogether. Numerous examples of nudges can be found in healthcare delivery. For instance, a clinical decision-making tool that reminds clinicians to complete a task is a nudge, as is the automatic discontinuation of antibiotics when a treatment course is completed. From the perspective of healthcare consumers, providing patients with easily accessible information about recommended treatments also serves as a nudge. In this DMP project, the primary nudge involved patient outreach to alert individuals about the importance of getting recommended adult vaccines. The easy accessibility of an employee clinic with a plentiful supply of vaccines made it easy for participants to respond to the nudge delivered by nursing outreach. The Quality Improvement Project employed a quantitative prospective design to assess whether vaccine forecasting and personalized patient emails would enhance vaccination rates for 3 adult vaccines: Tdap, Shingrix, and Prevnar 20. It was a collaborative effort between the health plan nursing staff and the nursing staff of the employee immunization clinic to ensure alignment with CDC recommendations for adult vaccines. The participants were identified using enrollment information from the health plan database. As the author, I reviewed the electronic medical records and the state immunization information system for contract holders and their partners who were enrolled in an employer-sponsored health plan as of April 1st, 2024. I then compared this information with the data entered into the collection spreadsheet by the nurse care coordinator. A total of 198 individuals met the inclusion criteria. Only those individuals with identified vaccine needs received an email invitation to utilize the employee immunization clinic. Scheduling assistance was also provided. The email outreach was conducted between April 24th, 2024 and October 1st, 2024. Data collection ended on November 30th, 2024. This slide represents the demographic information of the participant population. While inferential statistics typically require a sampling plan, this project included the entire adult population of one health plan. The total sample size consisted of 198 individuals, of which 98 were female, 49%, and the remaining 100, or 51%, were male. This age distribution chart shows that most participants were age 60 to 69, a total of 116 individuals. The next largest category of participants were those aged 50 to 59. To assess the change in vaccination rates, the data were analyzed using a lower tail z-test for the difference of two proportions. In this project, we measured the vaccination proportions of the same population at two different time periods, sample 1 and sample 2. We compared the number of vaccine doses needed before the intervention to the number needed by the population after the intervention. A decrease in the proportion indicated an improvement in vaccination rates. We set the significant level at 0.05. Before presenting the statistical analysis comparing the two proportions, I want to share the participants' response to the email outreach. 60% of the participants had vaccine needs and received an email to raise awareness, inviting them to make an appointment or visit the employee clinic. Out of those who received an email, 44% replied to the email. Among the participants who received an email, 31% scheduled appointments. 18% received vaccines on a walk-in basis. Now I would like to present the statistical analysis, which was accomplished by using the lower tail z-test for the difference of two proportions. This analysis compares the number of vaccine doses required by the population before the intervention to the number needed after the intervention. A decrease in the proportion of required doses indicates an improvement in vaccination rates. The results for the Tdap vaccine are shown in this figure. A z-score of negative 2.1585 and a p-value of 0.0154 indicates a statistically significant reduction in the number of vaccine doses needed for this population. The effect size is considered medium to high. This figure presents the results for Shingrix. With a z-score of negative 5.8533 and a p-value of 0, these findings indicate a statistically significant reduction in the number of vaccine doses missing in this population. The effect size is large, which supports the likelihood that the email outreach influenced the improvement in vaccine delivery. The final figure presents the results for Prevnar 20. The z-score is negative 1.2760 and the p-value is 0.1010, indicating insufficient evidence to support a decrease in the ratio following the email outreach intervention. Although some improvement was noted, the effect was not significant enough to draw a conclusion about the effectiveness of the email outreach. The primary limitation of the project was the time frame for implementing the email outreach, which was conducted during only one cycle of the biannual company conference that gathers all participants at the corporate headquarters. Since Shingrix is administered as a 2-dose series, the opportunity to deliver both doses was limited. Another limitation was the season of the project, which coincided with the company's fall conference. During this period, the employee clinic typically holds events to provide influenza and COVID-19 vaccinations to the workforce. It remains uncertain whether the participants were more or less likely to receive other adult vaccinations during this time. Lastly, nurses were generally hesitant to administer other vaccines alongside Shingrix during the same clinic visit. This reluctance stemmed from concerns about possible side effects, such as pain at the injection site, fever, and malaise. As a result, this hesitation may have affected the delivery of one or more vaccines. Another limitation of this project is its generalizability. It was conducted in a unique setting, focused on participants of an employer-sponsored health plan. This was a small group of individuals. The specific structure allowed for a highly tailored approach to forecasting vaccine needs and conducting personalized email outreach. In contrast, most self-insured health plans typically enroll tens of thousands of participants, which makes this project setting notable and limits the generalizability of the results. However, larger organizations may still apply the principles demonstrated in this project and utilize their access to technology to enhance vaccination rates among their participants. The Quality Improvement Project demonstrated that vaccination rates can be improved through personalized communication combined with easy access to a clinical site equipped to deliver vaccines. Key elements of this process included implementing standing orders and having a designated vaccine champion. The project also found success in enhancing vaccine awareness through email outreach, which led to statistically significant improvements in Tdap and Shingrix vaccination rates. Although there was some improvement in the delivery of Prevnar 20, it did not reach statistical significance. The study's results align with other research outlined in the literature review that showed that raising patient awareness through reminder systems can increase vaccination rates. However, it is essential to recognize that simply increasing awareness is often insufficient. The project also emphasizes the importance of removing access barriers to effectively implement a vaccination program. Additionally, it highlights that personalized communication from trusted healthcare providers may be more effective than automatically generated reminder notifications. The practice implications of this project highlight the importance of personal relationships with healthcare providers, the availability of healthcare navigation, and the need to address barriers to care. These barriers can include health plan availability and coverage issues, insufficient knowledge for making informed decisions, and the lack of access to necessary products and services. For primary care initiatives to be effective, each provider and clinical site must seek ways to address these challenges. Since each practice and patient population is unique, tailored solutions may be necessary for different situations. The findings of this project can serve as a starting point for those efforts. Furthermore, as behavioral psychology suggests, individuals are more likely to make choices that align with their best interests when they have access to the right information and resources. Ongoing research and clinical initiatives to identify best practices for overcoming healthcare barriers are essential, particularly for underserved populations and communities. In conclusion, the results of the Quality Improvement Project demonstrated that individualized patient outreach can be an effective strategy for increasing adult immunization rates, a critical aspect of primary prevention. This approach is particularly beneficial in small patient populations and contexts where providers can build personal relationships with their clients. I consider this project to be the first phase of ongoing quality improvement efforts related to immunization practices. It serves as a foundation for future initiatives. We discovered that utilizing corporate conference cycles, along with access to an employee clinic, can provide an ideal environment for delivering vaccine-related messages to patients. I am personally grateful for the positive impact that Maryville's Doctor of Nursing Practice program has had on my development as an advanced practice provider and as a leader within my team. My exposure to leadership principles, policy development, and statistical analysis has enriched my thought processes and enhanced my contributions to my employer, colleagues, and patients. We have arrived at the end of this presentation. Thank you for your time and attention.